Good morning. Great to be with you. Take off the mask while I speak. I want to thank first, foremost, everyone for taking the time to be here with us. Actually, maybe I should say thank you first and foremost for believing we'd get this done. It's been a while coming. Probably no one here was around in the time, but close to 50 years ago, people came and protested here. Yeah, we have a few. We probably should have you speaking because, actually, where was the demonstration back?
Right out in front of this building.
Right out in front. Amen. So close to 50 years ago, 1977, was it? People stood up to make sure that we had an opportunity to have quality of treatment. And now, close to 50 years later, I think we're trying to perfect that treatment to really make it far more equitable for everyone in America. And it feels pretty good to be able to say that we're doing this. It not only feels pretty good, it'll be pretty good for those who actually need this. Next time someone says, come in for your checkup, we'll make sure everyone in America gets weighed, right? To make sure that it's not just those who it's easy to do that with. Next time you go to a kiosk to try to get some medical services, we'll make sure everyone can access and utilize that kiosk. It's the very simple things that some people get to take for granted. And it's the very simple things that make life very difficult for a lot of folks because we did take them for granted. And so it is a wonderful thing to get to stand here to say that we heard you, we saw you, but we felt you. And today I think we are announcing, with the support of everyone from the President of the United States on down, that we are putting to practice the promise that was supposed to be equality of care and service. And so to all those Americans, including those who happen to have been here for the protest back in 1977, thank you for believing, thank you for being patient, but thank you for pushing to make sure that this happened. It is not just an issue of recognizing that Section 504 of our laws that treat Americans with disabilities should be implemented. It's making sure that we enforce. And perhaps the most important thing here on forward, enforce. Because it's great to have it in print. We want to see it in practice. And so my message, especially to someone like Theo, who's been working this issue for a long, long time, is we owe you. You've been good. But now it's time to deliver. And so I am thrilled to get to join Director Melanie Fontes Rayner, Acting Assistant Secretary Allison Barkoff, and Theo Brady. Is it Bradley? Brady, I got it right the first time. Brady. Theo, thank you. I got a chance to say to each and every one of them, thank you for standing here on behalf of so many people who really believed we could get this done. And it was time to get it done. I want to say a special thanks again to the President of the United States. This could have been done a long time ago. Could have been done in 1978, 1979. You know, every year we could have done it. And there were probably a lot of folks who made promises that it would get done. Joe Biden made sure we delivered. Yeah. And there is a lot to say about making sure that the person at the top makes sure you get this done. And so I think it's important to recognize that maybe we all wanted to get it done, but you needed to get sign-off from the man at the top. And so I hope we all recognize that simply saying that we want to do it is very different from actually delivering. And I thank President Biden for letting us deliver, whether it is on finally negotiating to get better pricing for prescription medication, finally making sure that we put minimum standards in nursing homes, finally making sure that we tackle the issue of Head Start and making sure that kids have an opportunity to learn with people who are getting paid decent income, finally making sure that we fulfill the promise to make sure that under our laws, including Section 504, we protected everyone's interest in getting the care that they needed. But now I'm going to turn it over to the enforcer here, because that's how we make sure we deliver on that promise. And so with no further ado, let me introduce the person who runs our Office for Civil Rights and the director who has made it possible for us to be able to say that we will enforce, Melanie Fontes-Rayner. Melanie.
The Secretary is always a tough act to follow, but I am very privileged to do so. So, good morning, everyone. Thank you for being with us today. You all know we're here to announce an updated civil rights rule to support people with disabilities and address discrimination across the country. Section 504 of the Rehabilitation Act is a law that became the law many years ago, and we know that the rules have been out of date for some time, and they don't reflect the many developments and changes we as a society have progressed for this community in health and human services. Developments such as, Olmstead, developments like the American Disabilities Act, developments like the Affordable Care Act, which promotes home and community-based services and also has non-discrimination health programs and activities, which we just finalized our rule last week, which is a complementary to this. Thanks, Allison. That's why the Office for Civil Rights at HHS is thrilled to issue this historic final rule to modernize and advance Section 504 and advance the promise of the Rehabilitation Act that so many advocates, even those not with us today and those in the room, pushed for, fought for, that we're advancing that promise. First, I want to take a moment of appreciation for our staff that worked on this rule. Many of you don't know how small the Office for Civil Rights is because of the amount of work we do in enforcement and rulemaking. We're on our 6th rule this year, which is aggressive and also the most we've ever done. My team, led by Molly Bergdorf, who is a tireless advocate and lawyer to advance disability rights. Our expert, our guru, as many of you know, John Wadach, who was here the first time these rules were written. Our line staff on both coasts of this country worked to read, respond to, turn around thousands of comments on weekends, late nights, and holidays, including support from our Office of General Counsel, with our critical support of our General Counsel himself, Sam Bagenstos, who for not, this would not be possible. The Administration of Community Living, great thanks to Allison Barkoff and her team, who cared so much about this rule, they literally gave staff to OCR to help get it done. So thank you. And of course, you can't get something done without great leadership at the top. So tremendous thanks to Secretary Xavier Becerra and President Biden's leadership that helped drive this work from the start. Yes. So today's rule takes a giant step to ensure equality in our health and human services for people across the country. It ensures that decisions about medical treatment are not based on biases or stereotypes. We received complaints throughout COVID-19 about discriminatory standards being used to discriminate against people who should be receiving life-saving care. Our rules ensure that the medical treatment decisions are not based on biases or stereotypes about individuals with disabilities, judgments that an individual with a disability will be a burden on others, or beliefs that the life of an individual with a disability has less value than the life of a person without a disability. It also, for the first time, implements a legally enforceable standard to ensure non-discrimination in the use of technologies that are routinely used in healthcare, including web content and mobile app and kiosks. When was the last time you went to a lab, urgent care, hospital, and spoke to a person? Today, kiosks and other web-based platforms are the norm. And many of you know that my mom, I'm the caregiver for, is low vision, visually impaired. She can't see. So oftentimes when she goes into these situations, unless there's a nice person in the lobby to help her, she has to wait to get help from the front desk, or she has to try to figure out on her own. And oftentimes it's very complicated for her and she can't. Or sometimes platforms that are just web-based. Again, a pharmacy, I won't say which one, has only certain services available on a web-based platform versus an app. My mom can't use an app on her phone that's not accessible for her, it's so much, like so many other people across the country. The new rule also establishes standards for accessible medical equipment that we can enforce under the law. Secretary said it. It has gone on too long that people are getting their weight estimated or going without mammograms. This will put us in place for medical tables and scales, as well as other equipment that will be medically accessible. Additionally, the final rule prohibits the discriminatory use of quality of life adjustments or other analytical methods which are used for cost containment, quality control, or algorithms that can impact a person's access to care and services. The final rule also clarifies that prohibitions on discrimination on the basis of disability apply to children in the child welfare programs, children and parents. Children, parents, caregivers, foster parents, and prospective parents with disabilities may encounter discrimination in the child welfare system. This rule sets out a requirement to ensure non-discrimination in those services provided by child welfare agencies, including but not limited to parent-child visitation, reunification services, child placement, parenting skill programs, and in and out of home services. Finally, this rule clarifies that recipients must provide services in the most integrated setting appropriate to the needs of the person with disability. By removing barriers to critical health care and social services, this rule advances justice for people with disabilities that have too long been subject to persistent discrimination. No life should be valued less due to a bias or a stereotype about a disability or simply because a person has a disability. Until this final rule takes effect, protections continue under our current rule, and we will continue to enforce the law. If you believe that you have been subject to discrimination, you can visit our website at HHS.gov/OCR. Thank you so much. Oh. And now I will introduce Allison Barkoff to speak next.
It is such an honor to be here today to celebrate with all of you this historic step forward in the disability rights movement. Building off this community's incredible advocacy for the first 504 regs 50 years ago, you all made clear from day one a must-do for this administration was updating these regs. The pandemic shone a spotlight on the catastrophic consequences of the long-standing discrimination, inaccessibility, bias, and stereotypes in our healthcare and human services systems. We saw disabled people told to get at the back of the line for ventilators. People couldn't access community services to stay safe at home, being forced into nursing homes where COVID was rampant. And these inequities created an urgency and a momentum for us in HHS to take this historic step forward in the first comprehensive update in 47 years. And as Melanie said, this is comprehensive. Everything from discrimination and medical treatment to accessibility of websites and kiosks and apps and discrimination in child welfare and Olmstead and more. And truly, with you and your advocacy as the wind behind our back, the rule released today creates one of the most powerful tools we have ever had to combat disability discrimination. Today is about making clear in the law that disabled lives are valuable, that people with disabilities have a right to live and fully participate in their communities, that disabled people can be and are good parents. It's about tackling the significant health disparities that disabled people experience, ensuring they can get in an office door of their doctor, getting on the table, that they're not denied life-saving treatment because of bias and stereotypes, and that they can get test results from a website. This rule reflects your lived experiences and your priorities. And I know when you read the final rule, you will see your advocacy and your fingerprints all over it, because this is the disability community's rule. But unlike 47 years ago, you didn't have to protest to convince us that this was important. As the Secretary and Melanie said, President Biden has really urged all of the federal agencies to update their disability rights regs, from HHS to DOJ to the Access Board and more. And from the moment Secretary Becerra arrived, he has had an unwavering commitment for the civil rights of disabled people. And every time I met with him, his saying is, "Don't do mild," and I promise you when you read this, we did not do mild. I want to thank Melanie, who is truly a champion for civil rights. And with so many critical issues that OCR is taking on all at once across the country, thank you to Melanie for prioritizing these rules. It's so important. We were so lucky to have Sam Bagenstos, our community's legal scholar and litigator, here to help us with his brilliance in working through really tough problems. And truly, without Sam and the OGC team, we could not have got this done. And again, a profuse thank you to the career team, including Molly and John and Elliot Kennedy from my team, people who bring their lived experience and their deep ties to this community to the work. We stand today on the shoulders of so many disability rights leaders like Judy Heumann and Andres Gallegos, who literally spent their entire lives fighting the pervasive discrimination that too many disabled people face. And it has been a privilege of a lifetime, both personally and professionally, to work on this reg. So I just want to say, we know that issuing this reg is a really important, but just a first step. And we are committed to working together and working with the community on the really hard work of translating these regs into reality. So thank you for your advocacy, for your partnership, and for your commitment. And I'm excited now to turn it over to my colleague and friend, Theo Brady, who's the Executive Director of the National Council on Independent Living, in recognition of the inextricable link between the independent living movement and Section 504. Theo?
I am so glad to be here. So I wanted to start off by thanking Secretary Becerra, Allison, and the rest of you all for allowing me to participate in this, right? Going on today in Harrisburg, it's a Capitol crawl, right? And when Allison called me and asked, could I be here today, I was torn. Right? The Capitol crawl. If you all know what the Capitol crawl was, right, it was the first time in the nation where people all over the nation came with disabilities, and they crawled up the steps of the Capitol, got out of their wheelchairs and whatever disability they had, and they crawled up those steps. And the whole world saw for the first time how the U.S. was treating people with disabilities. And it was a catalyst for really getting the ADA passed. And so in Harrisburg, the state capitol has steps in the back, and we can't use the front, and we have to use the back. And so it is significant to have that, right? And so I wanted to be there. But this is the thing. That is a reenactment of something that happened in history. This is history being made. So how can I not be here? Right? I had something to say here, elegant. Right? But I turned my phone off because I wanted to speak to you all from my heart. If you ever heard me speak, you need to know one of the things I always say is ableism is one of our greatest challenges that people with disabilities face. Today, ableism got punched in the face. And I love that. I love that. Because what ableism says is people with disabilities, they take. They don't give, they take. They don't contribute. It says that people with disabilities, when it comes to life-sustaining treatment and medicine, compared to an able-bodied person, the able-bodied person will get it because they're more valuable. How can that be in this day and age, right? But we got professional people, highly educated people believing in that. But today, collectively, we are speaking to that. We are punching ableism in the face, and hopefully it's going to be a knockout punch, and it won't get up again. But if it gets up again, it's going to be because we didn't do what we were supposed to do. Office of Civil Rights got a job to do, right? But we as people with disabilities and people without disabilities, allies of us, champions of us, need to do something too. And that's why I'm so excited that the President, Secretary Becerra, Allison, and everybody up here, they get it. They understand it. And they're doing collectively what needs to be done to really educate people about ableism. I don't believe it all intentional. I really don't. I believe people do stuff, create discriminatory policies and oppression, not always intentional. They're well-intentional folk, but based on lack of education and lack of interaction with people with all types of disabilities, based on their able-bodied experience, they sometimes do the wrong thing. That's why education is the key. That's why it's so important to recognize that people with disabilities contribute in major ways. And we cannot let all of this medical treatment, right, be denied to people with disabilities. It says something is called quality life adjustment years, right? It says that and COVID-19 proved this in a major way, when it comes to treatment, that you are an able-bodied person, that you're going to get the life-sustaining care. Because people with disabilities are not valued as much as an able-bodied person. That's nonsense. We can't let misconceptions and myths and stereotypes stop us from doing the right thing. I love this quote, and I'm going to end it with it. I'm going to probably mess it up because I paraphrased it so much over the years. But I believe it comes from Abraham Lincoln, where it says, when you have a cause, you put your shoulder to the plow. Plant your foot firmly and take a stance and get to work. So collectively, we are doing that today. We are putting our shoulders to the plow. We are planting our foot firmly, and we are taking a stance against ableism. Thank you very much.
Thank you, guys. We have room for a couple questions. Mackenzie in the back.
All right, we have Ian from Bloomberg here. I'm sorry.
Oh, sorry. Thank you. Questions for Mr. Becerra. You'd mentioned that the next important step here is enforcement. I'm just curious, can you give us an idea of some of the enforcement challenges that the HHS and OCR are expecting over this rule?
I'll tell you, I think probably the most important challenge, which we can overcome quickly, is getting information out to people that they have rights, and that there is now a stronger law to protect them that they're not aware of. And so we need folks to help us communicate to Americans with disabilities that they actually have enforceable rights. They can go to that physician's office and get the same kind of treatment, including just something as basic as we mentioned as getting weighed as anyone else. But it's giving people this sense, this understanding of what their rights are is probably the first but very overcomable challenge. I think the second challenge will be working with providers. I think most providers, when they understand the law, and most providers, I think, recognize their obligations to their patients, will want to get there, is making sure that there is no reason why they can't. Sometimes they'll tell you it's financial. Oftentimes they'll tell you they weren't aware. Either way, what we want to do is make sure that we're working closely with those who must implement the law the right way. And rather than always try to end up in court, perhaps working closely with them, we can avoid having to do it the litigious way. But either way, I think Melanie Fontes-Rayner and her team are ready to do it. The final thing I'll say is, you know, you never know what you're going to end up seeing come out of a judge or a court, and we have to push and be prepared because we may be startled in the way someone else interprets what we believe is the right to have equal treatment when it comes to accessing the health care that we need. But I'd say the first and greatest challenge, if we can overcome that, is giving people a clear understanding of what their rights are.
So I think that's actually all we have for today. Thank you all for joining us.
And can I just say one last thing? Give me your name.
Joy.
Can we thank Joy for having been able to keep pace with all the rest of us? I think it always helps to have a great interpreter, and thank you very much.
Produced by the U.S. Department of Health and Human Services.